Yeah, we took a little break this year in June as we do every year. Yeah, but we're back and we also do have a series of lineups of webinars for the rest of the year until November. So do look out for our communications on that, either on our website, EDM, or our Facebook page. And yeah, welcome everyone. I'm Kuna Yong, a research executive at SSR, and we are hosting this live webinar over Zoom. And we are also streaming this live on Facebook, where it will stay as a recording. So if you would like to view all our past seminars, you can also head there. And all our past webinars are there as well, so you can look through or share with friends. Yeah, so as some of you already know, SSR holds monthly seminars, which we have now converted to online webinars. And we hope to provide this platform for researchers and practitioners in the social service sector to share their ideas, research and findings with a larger community. And we also hope to provide this platform to spark some interesting discussions and maybe even like collaborations. Yeah, so in the month of July, though, we usually invite fellow students from the social work department to present their honors year theses. And this year, there were so many really good ones to choose from. So it's really hard to narrow it down. But we did narrow it down to 8, and 4 of whom are presenting today. The other 4 will be presenting in August. So do look out for that as well. And yeah, today's speakers are Isaac, Tai Xian, Clarissa, and Ming Fang. They will introduce themselves later on. But yeah, they are social work graduates now, and they will be presenting on topics ranging from social work practice to vulnerable populations in a time of COVID. We also have with us Ms. Denise Liu, who's a senior research executive at SEC FSC, and we thought she would be well equipped to moderate this session as both a researcher and a practitioner in the field. So after each presentation, there will be a short time for Q&A, and I'll share the link, the Pigeonhole link later. But yeah, there will be a short time for Q&A. You can submit your questions there. We will not be taking any questions from the chat, so please use that link. Yeah, and we are also trying our best, because we have so many presenters, to stick to our schedule. So apologies in advance if we don't get to your questions, but do vote on the questions that you really like, because I think that will appear higher on our list and we can prioritize those. Yeah, so hopefully at the end of all the presentations, we will also open up the floor in case you have any burning questions, any additional questions for any one of the speakers. Yeah, so that is actually all that I have right now. So I will pass my time to the first speaker, who is Isaac.
All right, thank you. Let me put up my slide. All right, so sorry that I have to keep my mask on because I'm currently in the office. But good afternoon, everyone. Thank you for having me today. My name is Isaac, and I'm actually a medical social worker currently at Tan Tock Seng. I'll be presenting on this study looking at stress and occupational determinants of psychological well-being in relation to social workers who telecommuted during this COVID-19 pandemic. Yeah. So to begin, I'd like to just bring us briefly through the definition of telecommuting for this study. Yeah, I think all of us would be familiar with the term work from home, and telecommuting is similar, but it's also different in 2 key aspects. So the first one being that telecommuting does not suggest that work must be done from the home itself. It can include cafes or co-working spaces, so it doesn't just mean work from home. The second one being that telecommuting in this study does not suppose that work must be done outside of the office. So conventional definitions always refer to work that's being done outside the office, but I think all of us for most of us as social workers, we will know that even under usual circumstances, a good portion of our work actually takes place outside the office already, such as home visits, community events. So, but instead of doing all that, we are now conducting these virtually from the home or the office. So rather than only looking at the completion of work beyond the office, this definition here that says beyond its usual environment allows us to contextualize the impact of telecommuting better for the social work profession. So just some background, because telecommuting in the social service is fairly new, my study actually looked into 2 areas for the lit review instead. So I looked at telecommuting and stress, and also social work and stress, burnout, and or compassion satisfaction. And across these 2 areas of studies, I found that there were 3 occupational determinants of psychological well-being that were consistently prominent. So the first being organizational support, the second being job autonomy, and the third being work-family conflict, which could be further subdivided into work-to-family conflict and family-to-work conflict. So the findings on the impact of telecommuting among other professions also found telecommuting intensity, that is to say, more telecommuting in terms of the workload or the frequency, to have some relationship with stress as well, although this relationship was mixed across studies and often mediated by some other factor. So nonetheless, this also informed us that telecommuting intensity was a factor that we should control for. So overall, despite the substantial research into telecommuting among sectors, none have actually looked specifically at the social service sector. And even in cross-sector studies that encompass different population groups, social workers only comprise about 3% of this study population. So we can't really generalize the studies for social workers. Further, when I was having conversations with various social workers, I noted similar struggles that were being surfaced, such as frustrations in maintaining a stable video call or maintaining the privacy of clients' data while they were video calling their clients outside of the office. So these practical struggles fell outside the 3 psychological determinants that were established during the lit review and were also therefore not considered by existing studies, but they all pointed back to very practical aspects of fulfilling the ethical responsibilities of a social worker. Yeah. So consequently, the study aimed to understand how telecommuting impacts the stress experienced by social workers by examining the direct relationship stress has with job autonomy, work-family conflict, and organizational social support, as well as also the lived struggles of telecommuting social workers, which was operationalized as ethical responsibility. So the study model for this study was adapted from the job demands resource model by Bucket and Demaruti. The study variables were classified as either job demands or job resources, where demands would result in greater stress, while resources would help to alleviate stress. And the hypotheses for this study are likewise based on this model. So quantitative cross-sectional design was adopted for this study, and I approached roughly 50 organizations by way of personal contact or general email routes, which some of you might have received. And in total, I received 48 responses. So the study itself comprised of 60 items and took about 20 minutes to complete. So before I go into the key findings of the study, I'd just like to take the chance to bring us through an idea of what our telecommuting scene kind of looked like. So overall, I only had age and gender responses from 24 participants. But from this 24, we see that the mean age was 32 and about 2/3 were female. And out of the 48 responses collected, the mean household size was about 4 packs, which is actually greater than the national average, about 3.22. In terms of work experience, our respondents were fairly split equally amongst 5 years or less, 5 to 10 years, and 10 years or more experience. And almost all of them were in direct practice. Additionally, nearly half of the respondents were from the family sector. And it's worth noting that there was actually an underrepresentation of social workers from the medical sector, largely because I think the MSWs were the first ones to return back to fully working from the office or in the hospital. Additionally, most of the people who telecommuted did so because they had to, and a large number of them also had a dedicated workspace at home, even though there was an average of 4 persons per household, only about, on average, 2 other persons would be around when the participant was telecommuting. And while all of them did work from home, 7 of them also did telecommute from other places such as cafes. So in terms of telecommuting workload, work was distributed fairly equally between completing via telecommuting means and via conventional means. But on days where participants telecommuted, more than half of the participants actually worked more hours. And almost half of the participants failed to keep to their usual working hours when they were telecommuting. So what does this all mean? The first key finding that we have is that we see the mean perceived stress score of 18.7 was actually higher than the pre-COVID general population average from a previous study. So this could mean 2 things. One, it could indicate higher stress among social workers compared to the general population, which is something past studies have found before. or it could also indicate that the whole national population is more stressed due to COVID or otherwise. But we can't confirm that because we don't have a comparative non-social work COVID-19 sample to compare against. The next thing we found was that work-family conflict appeared to be the main culprit here. So two models of multivariable linear regression were employed. The first one included all participants and excluded ethical responsibility. The second included ethical responsibility and considered only participants who were in direct practice and had to fill up that portion. And across both models, only family to work and work to family conflict were statistically significantly associated with perceived stress, with work to family conflict appearing to have a greater effect than family to work conflict. So this meant that participants probably placed a greater priority on family rather than work. And so when there were clashes between work and family, they were more likely to perceive these clashes as work intruding into their family rather than the other way around, which is understandable, especially if they are working from home. Work to family conflict may itself also be more prevalent since it can occur outside work hours, especially with the increased use of phones and WhatsApp for work communications. Conversely, family to work conflict will only occur when one is working. So the argument that family is prioritized over work is further supported by the associations surrounding one's deviations from their usual working hours. So one benefit of telecommuting, I think we can all empathize with is the flexibility in adjusting our own work hours. But not only did the study find perceived stress to be positively associated with deviating from one's usual working hours, it also found this association to be fully explained by work to family conflict. So this allowed us to hypothesize that participants likely adjusted their work schedules by choice so that they can tend to their own family matters, for example, rather than adjusting these work schedules because of work-family conflicts. And this resulted in an increased sense of work disrupting their family time, resulting in stress. So zooming even deeper, we see that participants who had a dedicated space for telecommuting were actually more likely to keep to their normal working hours, possibly because having that dedicated space helped them to maintain a clear separation between work time and family time. And indeed, those with dedicated space also experience less work to family conflict, possibly owing to this clearer demarcation. Therefore, they were more likely able to recognize that they were at work and therefore needed to prioritize work over family where required. So what are the implications? Well, firstly, it appears that we need to give an added focus on promoting work-life integration. So this means maintaining a clear separation and a healthy balance between the two, and not so much of actually enmeshing the two. And this is especially more important as it gets easier for us to work more while we're at home. Allowing workers to officially establish flexible telecommuting work hours that not only suit them, but that also clearly separates work time and family time may also be beneficial. So telecommuting can then be reserved for the completion of work tasks that do not need to be completed at specific points within the day, such as completing their case reports and documentation, rather than having to block out specific times to attend scheduled meetings or being on call. Next, corporate subscriptions or discounts to public co-working and hot desking spaces may provide alternative telecommuting spaces for workers who do not have such dedicated spaces at home. And this may help workers to maintain clearer boundaries between work and family, although we acknowledge that this comes at a cost. Partnerships with home service providers that provide food and grocery delivery, home cleaning, and laundry services may also help to alleviate the burden and perceived obligation of having to work on house chores while they are telecommuting, allowing workers to focus on their work. In fact, recently I heard one of my colleagues asking around for home cleaning services, so this may be an avenue to explore. So in conclusion, we see that work to family conflict actually warrants the greatest attention for future implementations of telecommuting within the sector. In particular, telecommuting arrangements should be supplemented by strong work-life integration strategies to help workers properly reconcile the overlaps between work and family time. And lastly, it is important to note that this does not mean we should give up on our current efforts in supporting workers' job autonomy and social support. The lack of statistically significant relationships between perceived stress and these factors could also mean that we are in fact doing well in these areas, and a discontinuation of current efforts may in fact cause stress, especially given that they are known to be important factors from our lit review. Finally, I'd like to also thank my fellow social workers and agencies who supported this study, who have contributed to this study. Thank you for your time. Please feel free to ask me any questions. Thank you.
Okay. Thank you, Isaac, for that very interesting and highly relevant presentation. I'm always very impressed when I see social workers who do quantitative research. So really well done there. We have one question on Pigeonhole. And the question is that, were there any gendered patterns in your findings? And I would also like to add on to that. I'm wondering also if you asked the participants whether or not they had children and whether you analyze those results as well.
Yeah. Okay. So in terms of gendered patterns, I did notice certain gendered patterns. So females did tend to experience more work to family stress conflict than males. However, they were not statistically significant, which is why I did not include them in this. Additionally, if you note that actually the sample size for gender and age results was actually very small. In fact, half of my gathered data, which was another factor in that. As to whether they have children, I did not specifically ask about dependence in this case. So I also cannot make any conclusions about that. But I would suspect, especially seeing how larger families do have a bit more stress, and that starts when the family size is more than about 3 per household, which would suggest that there'll be dependence in the household. These households do tend to experience more work to family conflict as well. Yeah. But so that is an interesting point, and I think it's also something that is worth looking into for future studies to actually look at how presence of dependents and even live-in caregivers or helpers might affect work to family conflict and stress overall.
Okay, I think we have time for one more question, and this one has 2 votes. So you mentioned that the percentage of social workers work past their usual working hours when telecommuting.
Yeah.
And then the question is, any idea whether this trend differs as compared to pre-COVID times?
I cannot answer that because I think in pre-COVID times, telecommuting actually wasn't a big factor as well. So if we're comparing against like a telecommuting arrangement, I can't advise on that. If we are talking about, for example, social workers working overtime in general, I did not actually come across any data on that either. So I unfortunately can't make the comparison. Yeah.
Okay, I think we have time for one more question.
Hmm.
So this question is you explain the effect of work-family conflict and is greater because it's more prevalent.
Yeah.
So I think the question is, do you have data on the prevalence of work-family conflict?
Sorry, can I clarify when we talk about the prevalence of work-family conflict? Are we talking about, for example, how many participants felt that they experienced work-family conflict?
Yeah, I'm guessing that's what the question is about. So do you have any idea what this prevalence is like, and perhaps how does this compare to, pre-COVID?
Okay, so in terms of work-family conflict, because I measured it on a scale, so it was a 5-point Likert scale. So I didn't actually quantify it to whether work-family conflict was present or not, which is why the scores were reported in terms of like a 3.06, 3.026. So I can't advise on how prevalent work-family conflict was. But pre-COVID, based on my literature review, pre-COVID, even without telecommuting, one of the commonly reported side effects or struggles with social workers is the fact that they tend to bring back their work home. So that could either mean really bringing work back to do up, such as documentation, or just being preoccupied with their cases, even though they're physically at home. So even though they are physically at home, their mind will still be thinking about their clients, about the safety of their clients, or being contactable by mobile. So definitely work to family conflict was already an issue, even without telecommuting. Yeah.
Okay, thank you very much, Isaac.
Thank you.
I think we've just run out of time. So can we invite the next speaker, Kai Xian? I think her presentation is also highly relevant to these COVID times. It's about therapeutic alliance and video conferencing.
Okay, I'll just put a part on my slides. Okay, is everybody able to see the slides? Okay, so I will start now. So good afternoon, everyone. I'm Cai Xian. So this afternoon, I'll be sharing an exploratory study into social workers' therapeutic alliance with clients in video conference delivered services in Singapore. So this is the flow of the presentation today, starting with the significance of study, moving towards the findings, implications, limitations, and Q&A. Please note that in the interest of time, only key information will be shared in this presentation. For significance of study, with control measures such as social distancing arising to control COVID-19, social workers rapidly shift from the usual in-person service delivery to remote service delivery using video conference, VC in short, as one of its tools. Therapeutic alliance, in short TA, is an important concept in social work because it's the collaboration between social workers and client towards achieving clients' desired positive changes. But literature have highlighted concerns of less personal relationship with clients and limitations of observing clients' nonverbal cues over VC, which might have an impact on empathy and TA. Thus, it's crucial to study social workers' TA in VC delivered services to uncover strengths and opportunities in this digital space. 3 research questions were explored in this study. By the interest of time, this presentation will only focus on 2 of them, namely social workers' experience of TA with clients when delivering services using VC, and social workers' perception of their use of selves in TA formation via VC delivered services. Synonymous to how artists uses paintbrush and paint as part of their tools in work, social workers' selves is the main instrument where our knowledge, skills, and attitudes actually facilitate change process in clients. Since VC is new in local social work practice, social workers' use of self is an important element and relevant element to be explored in this study. So one of the key concepts behind this study is the interactional theory of social work practice, where social workers' skills is found to be important to facilitate the formation of a positive therapeutic relationship with clients that could have a positive influence on the outcome of practice. Since social workers' selves is the main instrument in working with clients, by looking at their skills alone is not enough. Therefore, their personalities and personal beliefs were added for a more comprehensive exploration of their use of selves and TA formation in VC. For the therapeutic alliance, it will then follow Baudine's concept of TA with 3 elements, namely therapeutic goal, which is the mutual agreement of therapy outcome, therapeutic task, which is the behaviors, thoughts in session, or services provided in reaching therapeutic goal, and also therapeutic bond, which is the positive social worker client attachment. For research design and sample, 8 social workers were individually interviewed in this qualitative study, and they must meet this set of inclusion criteria, such as having at least 2 years of experience in direct practice. So a total of 7 themes were uncovered for these 2 research questions, but for this presentation, we'll only be focusing on 6 of them as shown on these slides here. So moving on to findings, for social workers TA with clients over VC delivered services, the therapeutic bond between social workers and client was found to be affected by the extent of presence both parties felt in VC services. Presence is defined as the idea of being in the same place as another individual, despite the physical location difference. So not being able to view and sense the full body language of clients, and clients not able to understand certain social work skills as mentioned by participants 6 and 7 respectively, has indicated a possibility that there's a distance felt between social workers and client in VC. And this might explain why social workers actually prefer to have in-person session with clients to form the therapeutic bond before using VC. And this is actually one of the themes found for social workers TA with clients in VC delivered services. Despite the challenge in sensing the body language, vibes, and certain techniques in VC, social workers were reported to be delivering similar tasks as in-person sessions, such as counseling-related services and practical-related services, as mentioned by participants 6 and 8 respectively. Interestingly, the use of VC is also found to reduce the power distance between social workers and clients, thus enriching the therapeutic bond. For example, for participant 2, she said that her client actually feel more relaxed over VC, and the communication gives a sense of chatting with a friend. Additionally, the honesty of social workers to share that they are new to using VC, as shared by participant 7, and their willingness to learn with clients on VC use actually equalizes the power distance as there's shared support, collaboration, and empowerment. Also, with VC being a neutral space where both parties have control over their personal spaces, could explain the informality, thus equalizing the power distance. And all these actually form certain perceptions social workers have towards VC use in social work practice. Almost all of the participants actually shared that they prefer a predominant in-person service delivery, and this could suggest that in-person service delivery continues to be the predominant mode of service delivery. Presence as defined by participant 1 here, she said that genuineness and compassion can be felt more in in-person sessions. And although previously it was mentioned that social workers deliver similar tasks in both in-person and VC sessions, the challenge for social workers to sense the body language and vibes over VC compounds their experience of presence over VC. Thus, they might find it easier to use VC for tasks that are more practical or structured, like information sharing. Thus, they might use VC for these functions more than counseling-related services, which involves the exploration of deeper feelings. Also, by giving clients the choice of receiving services over VC was viewed as important for participants to build therapeutic relationship with clients. And this actually complements how VC use actually reduces the power distance between social workers and clients as aforementioned. For demonstration of relational skills, there are similarities and differences in in-person services as well as VC services. For the similarity of skills would be careful self-disclosure as shared by participant 5 here. And the similarity stems from the fact that social workers need to understand the purpose and also ensure that they are self-disclosing appropriately to prevent blurring of boundaries. But when relating to clients over VC, they might have to do it differently by showing their empathy more overtly. And this actually is relevant with the aforementioned potential reduced presence that is experienced over VC, whereby having a more overt empathy, it can actually reinforce the presence of both parties in this remote service delivery. Aligning with other studies, creativity and the notion of staying true to oneself was observed by some social workers in working with clients over VC. For example, participant 7 replaces surprise in-person home visits with surprise video calls to continue connecting with her clients. And for participant 2 is to continue being herself, like how she would be like in in-person sessions, rather than becoming more animated over VC. And the unique traits of social workers was found to have an influence on TA, as well as client satisfaction in therapy, regardless of service delivery mode. Also, the ability to view oneself over the camera in VC actually could give social workers a visual feedback of their internal experiences, like their emotions and their thoughts, that can actually help them to be more present and attuned to clients' sharing to adjust for effective communication to foster high level of TA. So from the findings and discussions, the implications identified includes having a blend of in-person and VC service delivery. This is especially so by giving clients the choice of receiving services over VC could actually help to foster therapeutic bond. And for certain therapeutic tasks that are actually more structured or practical, it's actually possible to be delivered via VC. So this suggests a potential to use VC in social work practice, and this can help social workers to become more relevant and adaptable even beyond COVID-19. And to help social workers to experience presence in VC, training modification for existing and prospective social workers is needed. For example, skills training in the effective use of voice for social workers to be able to convey depth and emotion through their voice, and also just a mere understanding of clients' verbal sharing to truly appreciate the emotional content of clients' experiences. And also, despite the service delivery shift, social workers' selves has been found to be an important element, and therefore the curriculum should continue to emphasize on developing social workers' use of selves by identifying their unique traits and incorporation into practice to help them form TA with clients in VC delivered services. So for limitations, as majority of the participants comes from a generalized setting from a particular agency, the study might be skewed in this aspect. So future study could have longer recruitment period for social workers from different settings and agencies to participate in this study. Also, the service delivery shift to the point of data collection for this study was relatively short, and coupled with the high caseloads of social workers, they might not be able to meet with the same client over VC beyond the frequency stated in the inclusion criteria. Therefore, any changes in the TA at the later part of the helping process was not captured in this study. So future longitudinal study could actually help to capture any changes of this. And also to build knowledge from this current study, future studies could interview social worker and client pairs to find out their experiences of TA in VC delivered services to enhance understanding in this study. So with this, I'll end my presentation here, and thank you for your attention.
Okay, thank you, Kai Xian. There's a couple of questions. The first one, I know you didn't include this in your study, but perhaps when reviewing the literature, were there any findings about how the service users themselves perceive sessions via VC, or anything you've come across?
Personally, for this study, because the target of interest is social workers here, so the literature review mainly focuses on social workers' perspective. Yeah, but I do come across some of the clients' perspectives as well, and similar concerns were actually shared in the literature, such as having a less personal relationship over VC services, and also probably not being able to respond well because of technical glitches or something, since technology is used in this case. Yeah, so these are some of the things that I've come across in the literature, but the bulk of it is still in the social worker's perspective.
Okay. So the next question is, do you think there's a difference between the types of VC use? For example, Zoom, which can appear a bit more formal, versus a WhatsApp call, which is a bit more casual?
For this, because my study didn't really compare the differences of the different VCUs, but if I were to make a guess on this, I think there might possibly be a difference because like what you mentioned just now, people might associate Zoom with more formalized setting like meetings, etc. Yeah, but WhatsApp call is more immediate, so it might probably give a more informal sense. Yeah, but I think this is an interesting point that I think future studies could actually make a comparison with this as well.
Okay, so just one last question. I'm just wondering, did the social workers know the clients prior to using VC, and maybe what was the level of therapeutic alliance before VC was used? I'm wondering whether you explored those factors as well.
Oh, okay. Because part of my inclusion criteria is that they must meet with the clients for 3 sessions before. So prior to that, there will be this therapeutic alliance present. Yeah, so this is to actually eliminate any potential confounding factors. Yeah.
Okay, but I'm just wondering, did the social workers say anything about that level of therapeutic alliance before VC started, and whether that had any influence?
They predominantly said that they didn't really mention on that. Yeah, but they just So most of their sharing actually centers more on their experiences of using the VC and how it actually connects with the client. Yeah.
Okay, thank you very much. So I see there are other questions on Pigeonhole that we didn't get to answer. So maybe you can direct those questions to Kaisian, maybe by through the chat. Yeah.
Okay.
So can we invite our next speaker, Clarissa Chu? So her presentation is Understanding Bystander Witnesses of Suspected Child Abuse.
Okay, thank you. Let me just share my screen. Can y'all see it? Okay, great. Okay, good afternoon, everyone. Thank you so much for being here. My name is Clarissa, and I'll be sharing on my thesis, Please Scapo, Understanding the Experiences of Bystander Witnesses to Suspected Child Abuse in Singapore. Oh, sorry. Okay, so child abuse has been on the rise in Singapore for the past 10 years. And while that can definitely be attributed to better screening tools and more rigorous training given to professionals, it's undeniable that it is a problem in Singapore. And this was also thrust into the spotlight in the last couple of years by a number of fatal cases that involved very young children. And these cases in particular also highlighted the crucial role played by the non-professional bystander when it comes to protecting children, especially for very young ones who are not yet in school and have very little contact with formal agencies. These are just a couple of clippings from newspapers that brought up these incidences and highlighted the need for the bystander to be a busybody. At the same time, professionals and the public alike expressed the opinion that it's very unlikely for Singaporeans to step in because most Singaporeans believe that discipline is a private matter and they don't want to capo or intrude with a family's business. So with all of this in mind, I was curious to know, how do witnesses of child abuse in Singapore experience their personal decision-making process when deciding whether or not to intervene? And how are those decisions about intervention affected by their attitudes about intervening, subjective norms around intervention, as well as perceived self-efficacy when it comes to intervening action? So in order to investigate this, I combined Latane and Dali's model of bystander intervention with Esgen's theory of planned behavior to form my conceptual framework. So Latane and Dali theorized that when a bystander decides whether or not to intervene, he goes through these 5 steps of decision-making. And I wanted to combine that with the theory of planned behavior, the 3 factors that I mentioned earlier in my research question, to kind of tease out the nuances and factors that impact whether or not people are likely to intervene and how that decision kind of comes about. Yeah, and so for my study, I adopted a qualitative retrospective study, and I interviewed 8 participants. 4 of them intervened, while 4 of them had not. So all of them had witnessed an incident that they suspected to be child abuse that looked abusive to them. And individuals who are mandated reporters were excluded. So for instance, people like doctors, nurses, teachers, and social workers who are trained to catch and recognize child abuse in their jobs, they were all excluded from this study. And now we have a breakdown of participant demographics. So out of my 8 participants, this is the gender breakdown. The star participant, this female among the interveners, is in her 50s, but all other participants were in their 20s when it came to age. And every one of them is Chinese. So this is just an overview of my findings. I don't have the time to go through this today, unfortunately, so I'm just flashing it. If there's anything that catches your eye or you're interested in, you can feel free to ask later. But this is an overview of my findings according to my conceptual framework. As to what I will be going into in depth today for my presentation, it is these 5 things. So first, starting off with emotional arousal. So also for context, here on forward, for all things that are presented in blue, these are things said by interveners, and all things in orange are said by non-interveners. So across the board, among interveners and non-interveners alike, everyone was very concerned. Everyone felt some degree of emotional arousal or disturbance when it came to suspected child abuse, and no one was apathetic. You see very strong words of worry, being scared, concerned, and even traumatized by one of the non-interveners. So it's not that they didn't care about what was going on. However, how they differed in terms of their experiences and decisions were in attitudes towards child abuse, and we see this in the different evaluation of potential consequences by interveners and non-interveners. So what this means is that among the interveners, you see that there's a lot more concern about what happens if they don't do anything and what happens to the child. They were a lot more concerned about the child's suffering, how child abuse is persistent, and it's bad for the child in terms of physical, emotional well-being. On the other hand, for non-interveners, they were concerned about what would happen if they intervened and if they intervened badly or wrongly. They cited concerns such as it could pull them even further apart, it would affect the relationship between parent and child. Am I going to make the situation worse? And you don't want to add to other people's troubles or anxieties. So we see a very different alignment. While interveners were a lot more concerned for the child, non-interveners were more concerned for the parent or the family. And also I noticed when I was doing my data analysis that this lines up with what they noticed first. So when I asked what made you notice this situation, most interveners would tell me they heard sounds of a child crying, the child sounded very heart-wrenching. Whereas non-interveners would say, I heard a parent shouting, I heard a parent screaming. Another way in which they differed, the non-interveners and interveners differed, was their moral standpoints when it came to the topic of child abuse or what seemed like abusive discipline. So interveners spoke on a very strong moral position that this violence is wrong, I don't want to be a coward, and I want to do the right thing by the child. So you see very strong moral terms coming up among the interveners. But non-interveners were more prepared to give benefit of the doubt. They would say things like, there's no one way to do things in the world. Maybe the parent has stressors, maybe there are other factors, everyone grows up differently. So while the interveners kind of approach the situation from a standpoint of fixed morality, where violence against children is absolutely wrong and morally inexcusable, the non-interveners were a lot more ready to say that perhaps this kind of action is justifiable under certain circumstances, and it's not a moral absolute. Moving on in how they differed in terms of the perception of the self and other when it came to abuse, we see othering of child abuse occurring and this affected how people perceived the likelihood of child abuse as well as normality. So first of all, when it came to perceived likelihood, among the interveners, you can see it in the quotes also, there's a kind of identification with what's going on in the family where suspected child abuse is going on. So during the circuit breaker, I could feel that even in our own family, says this participant, our emotions were heightened. And we saw during the news that all families were experiencing heightened emotions. So we thought, oh, we better be more mindful of abuse. There's this kind of identification of the self with the experiences that are going on in the other household that make child abuse seem likely, like a possibility, which spurs them to action. On the other hand, one of the non-interveners explained that she chose not to step in because of this underlying assumption that child abuse is unlikely to happen in my neighborhood. So there's a kind of distancing or othering of abuse that makes it seem like an improbable or unlikely occurrence that disincentivizes action when it comes to stepping up as a bystander. Another way in which the othering of abuse occurs is how it affects one's perceived normativity of abusive behavior. So this is one of the non-intervening participants who shared that the father and daughter who he witnessed an abusive situation with were of a race different from himself. And it reinforced his idea that this race uses violence to discipline kids. When asked, would you have intervened if they were of your race? He said, yes. Maybe it's because it's easier to communicate, but also because I grew up in a family that didn't use violence and families of my race don't use violence. So in this kind of othering and distancing of abusive behavior of child abuse, it allows him to make it normal, a normal trait of the other that is not the same as the self, and therefore absolves him of responsibility from stepping up when he suspects something that looks abusive. Finally, one way in which we see self and other at work when it comes to child abuse and bystander action is in how subjective norms and self-perception interact. So all my interveners and all my non-interveners all thought that what they did was aligned with what general Singapore society, as well as what their friends and family would do. Intervening participants said, yes, Singaporeans are intervening, Singaporeans are helpful and would have done the same thing that I did. Non-interveners said, no, Singaporeans would never concern themselves with the affairs of others and we are not people in general. Nobody saw themselves as a kind of outlier or exception to the norm. And this came in most strongly in one of my interveners. One intervener actually initially said that Singaporeans are non-intervening. And he said this with a kind of disdain in his tone, saying that Singaporeans would prefer to stay out of trouble, not invite more trouble. But when asked what makes him run contrary to general society, he immediately said, no, I don't think I'm running against the grain. Actually, I think passive behavior is more prominent among the older generation, and young people like myself are increasingly stepping up, aligning his behavior with a majority young people who would step up and be bystanders, be active bystanders. So in this very rapid backpedaling and need to align the self to a majority, you can see that none of my participants wanted to be the other of society, to do something that other people wouldn't do. And what are the practical implications of all of these findings? I think first of all, it's quite clear that public education efforts and campaigns must address the concerns that bystanders might have on the consequences on themselves, as well as the families that they intervene with if they do intervene. And the consequences of non-intervention must be highlighted as well. I had a non-intervener who was quite concerned that she would be arrested by the police if she made a call and it turned out that it wasn't actually abuse. And misconceptions like this prevent people from making an informed decision when it comes to whether or not they decide to step up with suspected child abuse. So that has to be clarified. Another thing that I think is crucial is that assumptions and misconceptions about the likelihood of abuse must be addressed. That child abuse is not a problem that is confined to a certain other in society, whether it's by race or socioeconomic status. And finally, given the strong tendency of everybody to want to align the self with the majority and to see themselves as part of the norm, I think highlighting and spotlighting stories of intervention could be very useful if that's what we want to do, to encourage greater intervention by the bystander, because that way we can change the narrative around intervention and make it seem like a common act that everyone would engage in, and therefore encourage intervening behavior. And with that, I have come to the end of my presentation. Thank you.
Thank you, Clarissa. We have quite a number of questions. I think the top question right now is, it's a very specific sample. So how did you actually source for your interviewees, both the interveners and the non-interveners?
Oh, it was really just by snowball and putting out calls on social media to ask for people who have experienced something to come forward and tell their stories. It was definitely not easy, and I just nice had 8 people and that was it. Yeah, so it was really just by appealing on social media for people to come forward with their experiences.
Okay. And the next question is, I think you mentioned a bit in your implications about how your findings can be used, particularly on educating the public about the consequences of non-intervention. But how else do you think your findings can be used to inform, say, child abuse or domestic abuse campaigns to encourage more people to intervene when they notice child abuse happening?
I think, okay, firstly, like I said, greater clarity about greater clarity about the process is one. Because I think a number of even interveners said that after they had done it the first time, it became easier. But even among themselves, when they did it the first time, it was confusing. They weren't sure who to call. They weren't sure what they could call with. But as in, they were just the ones that were like, never mind, I'm just going to call anyway. But for others, that proved to be a barrier that they didn't want to cross. I think also, like I said, about the addressing misconceptions about the prevalence of abuse, like the idea that it can happen in any neighborhood, any racial group, has to be clarified, because the idea of like, it's not my problem is very strong. And I think one thing that I didn't present in this set of presentation was a lot of the non-interveners were very concerned about being filmed if they were to intervene and being placed on social media, because for some of these incidences, they occurred in public. So I think kind of even just bringing up this idea of intervention and talking about it as not something that is not shameful and changing the narrative, so that it's not something that you would be afraid to be filmed doing, but something that you could be proud of, I suppose, could prove to be very helpful, just to generate some kind of discourse around intervention. Yeah.
Okay, I think we have time for one more very quick question.
Okay.
So I think the next question is, what methods did they use to intervene?
Oh, okay. So out of my 4 interveners, I had some who approached the parent and child directly. So one approached the child, another approached the parent, and then the other 2 called. So call MSF or call the police.
Okay, thank you very much, Clarissa. Unfortunately, we don't really have time to answer the rest of the questions. Perhaps at the end, we can get back to them. So can we invite our next speaker, Ming Fang? And her study is on challenges and resiliencies of Singapore's homeless population during the pandemic.
Yes, hello. Can everyone see my screen? All right. Hi, everyone. My name is Ming Fang. So I'm actually a social work graduate as well, but currently I'm working as a social worker at South Central Community FSC. So thank you for staying here all the way until now and for the three presenters and their wonderful presentations. So I'm very honored and thankful to be able to share a bit about my thesis, which is Coping During COVID-19, the Challenges and Resiliencies of Singapore's Homeless Population During the Pandemic. So this is just a brief overview of how this presentation will look like. I'll go through the introduction, the review methods, findings, and finally concluding with some recommendations. Right, so during COVID-19, I think all of us are very familiar with these buzzwords, right? Stay at home, lockdown, quarantine, that have been articulated worldwide since the emergence of COVID-19. And in the absence of an effective vaccine in the early stages, governments have actually delivered suites of restrictive measures to contain the virus transmission. However, we think about it, the effectiveness of these containment strategies are premised on the assumption that citizens are able to remain in stable accommodation. So if stable housing is a frontline defense against COVID-19, what happens then to persons who are unable to observe these public health measures due to the absence of housing? So this was what my study was trying to find out more about, right? And there were 4 main reasons that persons experiencing homelessness are at greater risk. First is their inability to comply with containment measures, as earlier mentioned. Second, many rough sleep in environments that are conducive to virus spread. So this includes formal or informal congregate living settings with a lack of basic hygiene, supplies, and facilities. The third is that most of them have a presence of pre-existing health conditions, and medical comorbidities have actually shown to complicate COVID-19 cases. The fourth is misinformation and miscommunication. So beyond a pandemic, we're also experiencing what's known as an infodemic, which is an abundance of information leading to difficulties in distinguishing validity or trustworthiness of a source. So this may propagate non-compliance behavior to seeking help when unwell, or even such as using protective health supplies. So I would like to just define homelessness a little bit. For this study, I defined it as primary or street homelessness, which refers to people who do not have accommodation and sleep in public spaces that are not intended for human habitation. And we're using the terms persons experiencing homelessness, destitute, and rough sleepers interchangeably. So at this point, I'd just like to pause a little bit and ask all of you here, what comes to mind when you think of a homeless person? Right, so before we dive a little bit more, just want to share a little bit about my journey, which has influenced the scope of this thesis. So I was first introduced to homelessness when I visited a transition shelter that provides temporary shelter to families with children experiencing homelessness. And because of that, I was inspired to volunteer with Homeless Hub of Singapore, which is a charity organization that befriends and renders practical assistance to rough sleepers. So this was actually a piece that I wrote in 2018, a personal reflection. And instead of focusing on the deficits of the population, which sometimes public discourse does propagate, I decided to want to focus really on strengths and relationships as well. So social work practice actually recognizes that a population's strengths cannot be removed from, challenges cannot be removed from their strengths. So this was actually what grounded this study. And secondly, wanting to see crisis as an opportunity. So because of COVID-19, there was actually reports of a rise in help-seeking behavior, which increased the visibility of this community population. And this thesis actually hopes to contribute to the development of more robust response plans. So we actually came out with 3 study objectives. The first one, to explore needs and challenges. The second is some of the protective factors and resiliencies. And the last one was the role and sufficiency of community support. So moving on quickly to a little bit of a lit review. I draw from Dr. Nkokpo's nationwide street count. He actually found in 2019 that there were about 921 to 1,050 people experiencing homelessness at any single point in time. Most of these people were older Chinese men, and these are the 4 primary causes of homelessness. So recognizing that this population was especially vulnerable to the pandemic, as earlier mentioned, the government approach in Singapore, which was led by MSF, was twofold. The first was collaborating with 35 existing partners from peers to create what was known as safe and sound sleeping spaces. So these were designated spaces for rough sleepers to sleep. And they spoke with churches, mosques, temples to open their premises, and they also converted vacant rentals flats for persons experiencing homelessness to stay at. The second was actually proactive outreach by the peers network, also known as Partners Engaging and Empowering Rough Sleepers. So for this, practical aid was provided for such as care packs, which included masks, for example, and they were linked up with services and or extra kits. So just moving on, I just want to share a little bit about my framework. I drew on the human scale development framework, which was developed by Manfred Wexneath and his colleagues. So this is actually a taxonomy of human needs. And what he advocated for was that any inadequately satisfied need reveals a human poverty. I think some of us may be familiar with like Maslow hierarchy of needs, which is a tiered sort of need system, but this actually contrasts with the conventional types of frameworks that we see. So my research questions were as follows. The first was how the COVID-19 pandemic affected the homeless population. The second were factors that contributed to their resiliency. And the third was the role that community and services play. Moving on to methodology. So I used qualitative semi-structured interviews, and recruitment was done. I had 10 healthy adults aged 51 to 76, and all of them had experienced or were experiencing primary homelessness for at least a minimum of 1 week since COVID, since 7 February 2020. So this was when Singapore activated DORSCON to orange, which is indicative of moderate to high public health impact. And so this was selected. I used purposive and snowball sampling, and this was done in collaboration with HHOS as they have access and existing networks to persons experiencing homelessness. And this time I also like to just thank some of the HHOS for granting me this opportunity to actually collaborate with them. Yeah, so I conducted qualitative semi-structured interviews. Data analysis was done by thematic analysis. So thematic analysis is a qualitative method for uncovering a collection of themes, also known as some level of pattern responses. So from the transcript, codes, which are different categories, was generated, and thereafter they were categorized into themes. Moving on to findings, here's a little bit of the participant profile. So a total of 10 participants between the ages of 51 and 76 were interviewed for my study. All were male Singaporean citizens and had experienced homelessness for at least a week during COVID-19 pandemic as earlier defined. In terms of ethnicity, there were 5 Malay, 4 Chinese, and 1 Boyanese participant. And at the point of data collection, only 1 participant was in stable housing, while the rest were still experiencing primary homelessness. And of those who were interviewed, 5 were experiencing homelessness due to COVID-19 pandemic as a result of travel restrictions to neighboring countries, such as Indonesia, whereas the other 5 had were displaced due to family conflict and or personal choice. So 3 participants actually had up to tertiary education, while the remaining 7 had secondary school education and lower, and a good mix of participants, 5 was in sustained employment, while the other 5 were unemployed. 4 were married, 2 were separated, and 4 were single. Okay, so these are my findings. It's a broad overview. 3 main needs and challenges and 2 protective factors were identified. I will go through them. So the first needs and challenges was the increased frequency and level of enforcement that was experienced by rough sleepers. So although literature suggests that this is very common, these were reported to increase sharply during the pandemic, where there were checks by the auxiliary police and all the security guards, which actually resulted in frequent sleep disturbances. And these accounts actually demonstrate the unbalanced power dynamics between these officers and persons who are experiencing homelessness, and compliance were often obtained from the latter. And persons experiencing homelessness were also unable to have privacy and persons experiencing homelessness had lacked privacy and also respect, which had compromised on their fundamental needs. The second finding was how many were displaced due to travel restrictions. So due to the closure of the Harbourfront Ferry Terminal, many participants in Singapore were displaced and became homeless and were separated from their family overseas. So removed from the comforts of their own home, they were not able to have that shared space of togetherness that they often shared. So one participant actually said that when they video call their family, they felt very happy, but inside they experienced a lot of sadness and pain because they were separated. So this also resulted in more feelings of worry, helplessness, and longing. So another needs and challenge is the disproportionate levels of understanding about COVID-19 between the higher educated and the lower educated rough sleepers. So in this study, 3 participants had up to tertiary education and 7 had secondary or lower. So with the highest education of only P6, right, there were 4 participants who actually struggled to articulate how the virus was transmitted. And they also received news from less desirable sources such as Nestia, which are not the most credible. And this was in contrary to 2 other participants who had attended universities. So they were able to articulate in great length about what the pandemic was about. They also appeared to be more informed about international affairs and read from various news sources such as BBC, Lianhe Zaobao, for example. Another finding is a protective factor. So this was actually a less salient, but it's quite a unique factor that we wanted to highlight. So we may commonly think of the homeless population to be homogeneous, but employment was actually found to be a factor that differentiated their social identity. So those who were employed reported a sense of belonging among their peer groups, and then they actually assigned the words lazy and no face to the unemployed. And in Chinese culture, no face is actually a concept that refers to a lack of respect, honor, and social standing. So this demonstrates that there's actually in groups that were created and the population is heterogeneous. Another protective factor was actually the homeless friends, the ability to self-regulate and the presence of community supports. And community actually provided 2 types of supports. Primarily, it was instrumental support like linkages with shelter systems and also provision of supplies like masks, and emotional support with their family and friends through video calls and conversations. So moving on to recommendations, these are the findings that I had in summary, and I will focus only on 1C and 2A. So for 1C, the part on disproportionate understanding of COVID-19. So digital literacy has actually become a basic need in today's society, as we all know. And findings revealed that the lower educated rough sleepers were unable to discern credibility of sources. So a suggestion is actually to adopt community-based approaches to identify and encourage key persons in the population who may be higher educated to educate their own peers. So individuals experiencing homelessness have the highest touch point with others in their community, especially during crises, which is something that we will not have as formal systems. So this is a suggestion to actually identify these persons and educate them, and then have them disseminate information to others. The second recommendation is to provide more targeted support for unemployed persons. So employment was seen as a social determinant that differentiates the rough sleepers, which resulted in different intergroup behaviors. So support for the unemployed could look like for their subsistence needs like food and financial support, and affection needs like emotion, sense of togetherness, and provision of emotional support. So those were my 2 recommendations, and here is just a brief on my limitations. Okay, so that is the end for my presentation. I'll take any questions now.
Okay, thank you, Ming Fang.
Thank you.
So the question is that since COVID is slowly becoming endemic, how can we continue to support people who are experiencing homelessness?
Right. So perhaps I can just go back to the slide where it shares about the national responses and some of the initiatives. Where is it? Right. So there are actually a lot of different initiatives and ground-up groups, and on a ministry level, there has been great support. So volunteers actually make up a bulk of befrienders, and we provide outreach under the peers network. So continuing to support persons experiencing homelessness, we'll look at really crisis intervention, right? If they are really, due to COVID-19, they have additional challenges such as loss of employment, or because they are displaced due to family conflict, for example, we can provide the interim assistance. And then it's also supporting them in the longer term in really looking at higher order needs, such as affection, building that community for them.
Okay, so the next question is about your participants. So you mentioned 5 were homeless because of travel restrictions, but the other 5 were due to family conflict. So I'm just wondering, for those 5 who were homeless because of family conflict, were they already homeless before COVID? Or did they become homeless during the COVID situation?
Right. So some were actually homeless prior to COVID, whereas the others were actually displaced. So I think it was 2 participants that were displaced as a result of COVID. So there was conflict with family, for example, but then the others were actually, they had been homeless prior.
Okay, thank you, Ming Fang. So we've come to the end of all 4 presentations. So there are a couple of questions that haven't been answered on Pigeonhole. So maybe we can go back to some of these questions. I think there are quite a number of questions for Clarissa's presentation. So I think the other question that we didn't get to is about whether there were any personality differences between the participants, and also whether the definition of intervention included offering help to the child instead of just trying to stop the violence. So what was that definition of intervention?
Okay, I'll answer the intervention one first. Yes, I included approaching the child. So one participant invited the child into her house. It was a neighbor situation, and the child got thrown out. So she invited the child in. So that in that case, she didn't interface directly with the parent. And as for whether or not personality differences were accounted for, I think it was really hard to do that because I don't think an interview is enough to tease out like personality differences per se. So I unfortunately don't think I have enough to speak on how personality affects whether or not you will interview. Interview.
Okay, thank you, Clarissa. So I just have one final question for all the presenters today. I think personally, I'm very impressed by the quality of research presented. The findings are certainly very, very interesting and relevant to social service practice. So I'm just wondering, given that you did your thesis during the pandemic, did you face any challenges while doing data collection, and how did you overcome some of these challenges? So this is for all 4 speakers.
Okay, I think I think I can go ahead and answer that first. For my particular study, I was looking at social workers who were telecommuting, but I think the situation with COVID at the end of last year was changing quite rapidly. So I was actually fighting against time in the sense that we were preparing for phase 3. And in fact, when I finally got approval and got to the data collection period, we had just entered phase 3. So agencies were also slowly transitioning back and away from work from home. So I think one of the challenges that I faced was really getting a good population, a good study sample, given that they were slowly transitioning away. Yeah. In terms of coping with that, the original design was actually to just recruit via snowball sampling, and I wasn't really intending to cast my net that wide. But because I realized that agencies were all slowly moving back, that's when I actually decided to go wider and get support from all the different agencies. So I had a whole list of agencies. I started emailing all the general inquiry routes. Yeah, but even then, I think a good proportion of the agencies were either very swamped or already making that transition back to the office arrangement. Yeah.
Okay, thank you, Isaac. How about the other presenters? Did you guys also face similar challenges?
Maybe I can respond. I think sort of similar to Isaac. For me, thankfully we were at phase 3, so mine was qualitative. I actually did face-to-face interviews, and at that time it was allowed. So that was really a blessing. So I did that during December. Yeah, and other than that, I really had the support of the volunteer organization Homeless Hearts of Singapore. So that was really very helpful because they already had connections and networks. And I think it's important that we collaborate across services, right? And I found that to be especially helpful for my thesis.
I can go next, I guess. I think personally, I didn't experience as much COVID-related difficulty because I think, as in, I did a combination of Zoom and in-person interviews, depending on what my participants preferred. Uh, and thanks, I guess, if this like demographic would be difficult to find with and without COVID. I was just blessed enough to have just nice 8 people. But yeah, I don't think my difficulties were COVID related. If anything, I think the Zoom medium does open up a lot of possibilities, especially if the other side is guaranteed stable connection. It was quite easy actually. And they were, I think, comfortable in a sense because they're in their own home and they are, it's their own, like, it's a lot more convenient for them. So I wouldn't advocate Zoom for all interviews, but in my case, it worked out for the better. Yeah.
Okay, maybe I'll go next then. So, closely related to what Clarissa and Isaac have said, personally, I didn't face that much of a challenge because even though face-to-face interviews wasn't allowed, but Zoom actually opened up the possibility for me to still able to get the interviews done. And although social workers back then are already also slowly transiting back to using face-to-face service delivery, but with carefully crafted inclusion criteria, that wasn't much of an issue. I still can actually get the required and appropriate sample to get the responses for the study. Yeah.
Okay, thank you very much. So I would like to hand the time back to Cleona. Yeah, so thanks again for the very interesting presentations. And I'm really looking forward to the next session.
Yes, thanks all the speakers for sharing your thesis with everyone and for answering the questions so well. And also a big thank you to Denise for moderating the session and selecting the questions to ask. And I just have a few announcemements to make before the end of this session. And one of them, I will be launching a poll for SSRs, just general for feedback. So if you could do this while I make some announcements, that would be good too. So, all right. As I said, we are streaming this live on Facebook, and the session will be uploaded once this is over. And so if you have any colleagues or friends who would be interested in watching this, or if you would like to refer back to this at a later date, you could watch this session and all our past sessions there. And another announcement we have is our next webinar is 26th of August, which is a Thursday, the same timing as today's. And we'll have another 4 speakers who are social work graduates as well, sharing their theses as well. Yeah, so do look out for the sign up for that. I think it's already out on EDM and Facebook. You can also scan this QR code on screen to register. And that is all for today. Thank you so much again, everybody, for joining us, and for the speakers for presenting, and for Denise. That is all. Thanks, everyone, and speakers, and Denise, you may feel free to leave the session. I will just leave it open for the loop slides.
Okay, bye everyone. See you when I see you.
Bye.
Bye, dear.